You know, it's one thing when us as adults get sick. It's a totally different thing when our kids get sick.
Absolutely. And your level of concern as a parent goes way up for your children. And today on the Be Well Now podcast, we're going to talk about how and when to get your first chiropractic care.
This is Be Well Now. Hey everybody, Nick with the Be Well Now podcast. I'm the Curious Patient, joined by Dr. Ron Dummar here in Heber City, Utah.
Hello everyone. I hope you're excited to talk about pediatric chiropractic today.
Well, we hope that folks out there believe in chiropractic, but if they don't and they're skeptical, I'm even more excited for this conversation. So let's tell them who you are, your level of expertise, and why we're talking about kids' chiropractic care today in terms of their overall health.
Yeah. Well, in this regard, who I am today is a father of 6 children, and who has had an intimate part to play in their being raised. So how they're brought up, their health, their wellness overall, I've been intimately concerned about their highest health.
As every parent is.
Mm-hmm. And so I've been that for my kids. And as I've had my children, I had 2 children going through my medical training through chiropractic and through Chinese medicine programs. And so you could say, well, perhaps my own children provided some level of guinea pig for me, or you could say that they were lucky enough to have me to practice those modalities that now I get to use in clinic every day on lots of children.
I mean, I can just give you my example. My ex-wife, so the mother of my kids, would not let me bring them to a chiropractor if they get sick. Now, if I get sick, you're my doc. Like I know that Western medicine has a place, and I'm not here to take any stand in terms of I'm right, you're wrong, because I'm not the expert. I just know what works for me. There are people out there who don't even believe in this, let alone for their kids. Do you want to start there in terms of, we're talking about healthy kids. We're also talking about at what age do you bring your kids to a chiropractor for wellness or when they're sick?
Absolutely. That's a really good question, because there are people who have misconceptions, misinformation, and then also people who have had legitimate contact with individuals who believe that they've been hurt, right, by a chiropractor. And so when you're looking at someone in that regard, or when they have that life experience, if you use their life experience to base your decisions on whether or not to see a chiropractor, I think it's important that you also have to dig deep and say, okay, not just take the negative or not just take that one experience, because if you look in every industry, if you look in medicine, there are people who have rags left in them after surgery. There are people who have reactions to medications, or have all sorts of different injurious events occur because of the hospital or because of a prescribed medication. In fact, one of the leading causes of illness in our country is properly prescribed medication overdose.
I worked in the news business, and I would go to the local airport where the plane crashed.
Mm-hmm.
And there would be the local flight instructor who would tell me, flying is incredibly safe. You're more likely to get injured if you're going down a 2-lane highway and you don't know if the person is drinking, tired, smoking, on their phone, coming in your direction. Because the statistics bear out that you're more likely to get injured driving. But there is something you cannot turn away from when a plane crashes. Do you believe there's something in a parallel way with chiropractic, that the 1 out of 1,000,000 times, or I don't know what the stats are, but the story on the news where you hear about this one thing, or people's perception about, I'm getting my back cracked, does a disservice to your industry? Even if I'm saying it and you're kind of smiling like, here we go. You know, people think that out there.
Yeah, well, the reality is there's a risk with everything that we do. And that's the stark fact of it, of everything that we do, whether we fly a plane, we get in an automobile, We play at the park. We go down the slide. There's a risk with everything that we do. We could take our child to a bounce house, right? There's so many different things that we do in life that they all involve a level of risk. And so what we're trying to do is mitigate that risk. Well, in chiropractic training, we go through an intense level of training on biomechanics, on the physics of adjusting, on the anatomy, and the proper setup and orientation and delivery of each of those maneuvers. And so we deliver that with the highest amount of safety and accuracy so that we mitigate and reduce the chances of any sort of mal-event occurring. If you look at the actual statistics, it is about 1 in a million. It is really, really low.
What is about a 1 in a million?
To have an injury, to be injured due to a chiropractic event. Now, most of what people have heard about is having some sort of cerebral vascular or a stroke-related type event, and that's because your vessel travels right through your neck and up and into your brain, and it supplies your brain with blood. And if you turn and twist the neck real vigorously, it can cause an injury to that vessel. Okay, and so that's what a lot of people are concerned about with having their neck adjusted. Again, what we've found when you look at the research and literature is oftentimes people present to a chiropractor with symptoms of a cerebral vascular event. And so it's really that chiropractor's role and duty to determine, is this a cerebral vascular event already? And should I be sending them on for further imaging? Or is this a candidate for an adjustment and they're in the clear? And so is it possible that someone might miss that? Yeah, that's possible. But like I said, we go through rigorous training so that we don't, and so that we have the patient's best interest at heart.
So why does getting adjusted improve my health? Because a lot of people are in pain and they want to come and get their pain relieved. I know everything's connected, and I'm playing a little dumb here, but at the same time, I have no idea. So it's both things at once. How does this improve my overall health? Let's forget about the kids for a second. If I'm feeling crummy or if I'm feeling whatever, how is getting adjusted helping my health? Because all I think about is relieving my back pain or my neck pain or whatever I'm here for. It typically would be something acute, I would think. I'm going to go to the chiropractor because I'm in pain.
Well, and most people do that. Most people, we encourage people to come in when they're not in pain as well. So to come in for a preventative or for a tune-up or to have their spine checked. In a dental setting, I would call that a cleaning. We're going to have you come in for a cleaning. Why? Well, we want to make sure that everything is where it should be, it's all in good order, and that we're preventing any perpetuation of a cavity. Okay? Well, what happens in the spine? Well, in the spine, if we're not moving properly, if the joints begin to shut down, or if there's inflammation in and around the joint, inflammation is the itis in arthritis. Okay? And so if you have inflammation that starts to set into your spine, it usually is a result of a restriction in mobility. So if that joint is not moving properly, you're going to have degeneration and or arthritis form. Okay, now that is, if you've seen these x-rays or if you've looked at your own x-ray, some of these people's x-rays look like those pictures that dentists would show you. You see those rotten out teeth and the gums all deteriorated, and we see this on film as well, x-rays. And you can see where the ligaments and the muscles and the tendons and the bones all just start deteriorating. And they're doing that because they don't have the proper motion. The spine requires proper motion in order for it to get its sufficient hydration. So there's not an actual vascular, like a blood vessel, that goes to your disc. The disc is what cushions our spine, the bones of our spine, so that they don't essentially crack and break. right?
So the spine is one long thing and the discs are like protecting
Discs are like, it's like little Oreos all the way down, right? So you have discs in between each of them. Yep. So you'll have a spinal segment, you'll have a vertebra, and then you'll have a disc in between. Now, there's no supply of fluid or blood to that disc, but it has to stay hydrated. So the question is, how does it stay hydrated?
So the disc is attached to the spine.
The disc is part of the spine.
Part of the spine.
Yeah, so it's literally stacked. So you have a segment right here, right? And then right underneath it, you have the disc. And then you have your vertebra, your bony part of the spine. And then you have another disc. And then stacked again. And it goes all the way down.
So a disc needs to stay hydrated. What about the spine itself?
Well, the spine needs to obviously maintain proper hydration. It needs good hydration. It needs good movement in the segments or the joints of the spine itself. But my point with the disc was, how does it become hydrated? Because when we look at an X-ray, we start to see people will lose disc height. And if you start losing disc height, that means you're perpetuating and setting the stage for a disc herniation or a disc bulge. And this is when people start getting pain down their butt, pain all the way down into their leg or into their foot. It's when they feel like they're crippled and they end up in here trying to get rehab and take care of a disc that is already now a problem as opposed to preventing it before. So how do you hydrate a disc? The way to hydrate a disc is with motion, with appropriate motion in the spine. And if you have inappropriate motion, like if you have too much motion on one side, it'll cause a dysfunction and it'll cause wear and tear, almost like your tires on a car. So if you have a misalignment in your car and your tire, you have one tire going this way and you're trying to drive down the road, first of all, you can feel it as you're on your steering wheel, and that tire wears down so much faster, right? Well, the same thing happens in our spine. If we don't have our joints all moving and aligned appropriately, then we're going to have uneven wear and tear, and we're going to develop degeneration. And then people end up with these MRIs or these X-rays that come back, and we have these reports we get to read. Look, you have degenerative disc disease, or you have, a disc herniation or a bulge, or you have lipping and spurring and all sorts of arthritic and degenerative type changes. We in chiropractic have been proven that our work has shown to reduce the progression of those conditions.
So you promote hydration of the discs, and why do you want them hydrated?
Because they're full of a material that it needs to be hydrated. It's like water or fluid inside the disc, and if it becomes dehydrated, it will shrink.
And what happens if it shrinks?
And if it shrinks, you lose disc height. And then also if it starts to shrink, it will push. You'll have a certain amount of pressure that can push out the side, and it can push into your spinal cord. So your spinal cord is the nerve that communicates to your whole body. Things in the environment, right? You receive input from your spinal cord, and then also you can receive things from the environment, and it goes through your spinal cord and communicates to your brain. Well, if you have a disc herniation, it can push on your spinal cord, and it can cause a disruption with your bowels. It can cause a disruption with your ability to properly urinate. It can disrupt your ability to lift your leg even. It can cause numbness, tingling, all sorts of things that can develop as a result of your spine being impinged from a disc herniation.
So you're promoting, obviously, the spine working in an optimal way. Even if people have had issues, you can help them get better?
Yeah, even if someone has already found themselves in a situation where they have a disc herniation, or they have even had a surgery for some sort of back-related issue, we can still work with them for the most part. In fact, I have a variety of different approaches and techniques, and chiropractic has that at large, where even people I have a patient who comes quite regularly. She has rods in her spine. She had a 50 plus degree scoliosis as a child, and they decided to do rods. So she has 2 rods all the way up and down her spine. from her pelvis basically all the way up to her neck. And can I adjust, and can we help provide some level of relief and function, improve the function for that patient? Absolutely. And we do.
So chiropractic care is pretty mainstream these days. And yet, someone who might generally feel positive about chiropractic may still hesitate to bring their kids to the chiropractor. So let's jump off there. Let's talk about what your philosophy is on chiropractic care, adjusting kids. What early age do you start at? Do you not start? Obviously, I think you're going to tell me when they're infants, but you go ahead.
Yeah, well, as soon as you feel comfortable, I say to my mothers, I treat a lot of our patients through their pregnancies. And so we treat the pregnant spine because there's a lot of aches and pains that we can help mothers alleviate during the pregnant state.
And how does that help if you're pregnant?
So what we focus on, I am a practitioner of a technique called Webster technique, which is a specific to pregnancy and pediatric technique. And what we do is we work to maximize the space in the uterus for the fetus to present. And the way we do that is we focus on the pelvic balance and alignment, and then we focus as well on the joints of the spine. But maybe one of the small differences or the nuanced differences between traditional chiropractic and Webster is that we focus on the round ligaments, or the ligaments that actually attach to the uterus. So a lot of women will have lower abdominal pain or twinges, and they'll misinterpret them as Braxton Hicks, and they're actually round ligament twinges or round ligament pains. And so we'll work on the uterosacral ligament by accessing other ligaments posteriorly that will influence that. And then we also will work on the round ligament anteriorly that attaches to the abdominal wall and the uterus. And essentially we apply a certain amount of pressure to relieve spasms and to prevent any perpetuation of spasm for the patient.
I believe that you know a lot, and I'm sort of a little lost on some of that verbiage, but I can tell that you'd be the guy that I would want taking care of whomever might be with child.
So if you think about it this way as well, we do get referrals from local OBGYNs and a number of our patients, depending on who their care provider is. We have some of our patients choose midwives for their care providers or certified nurse midwives. Some of them just want their primary care to do it. Others choose an OBGYN. And so we do get a variety of different referrals from those sources. But in each of those cases, it's a matter of sitting down and analyzing, okay, what is needed for this patient? Are they having that round ligament tension or pain? With the assessment that we perform, we can determine and detect what is necessary or needed. There's also ligaments that course all the way up. They travel all the way up from the coccyx or the sacrum. They move all the way up the spine to the cervical and towards the head, okay? And so what I'll do is I'll apply pressure, a gentle pressure that helps to open up the spine and the joints, and we'll apply pressure down in the sacrum and then move all the way up to the head and stretch and open up that whole spine. And mothers will just move in and just reach a really relaxed state, almost like meditation, as we're doing this adjustment. Doesn't sound like anything that people would have traditionally heard of or been familiar with as it comes to chiropractic. It certainly has nothing to do with any sort of high velocity thrust, but it does work, and it is effective in mobilizing the joints of the spine.
And everything's connected. So if you can do something to relieve tension within a mother or to a mom-to-be, someone who's pregnant, what does that do for the entire ecosystem of the body and the child?
Oh, absolutely. You imagine the hormones that are released. The hormones that are released as we do that treatment, and as mom is able to get the relief and some relief. Obviously there's a certain amount of relief she's not going to get until after, she has the baby. But she gets some relief, and this level of relief that she receives, it releases hormones and endorphins in the body. And absolutely the baby receives that. And is able to respond as well to the release of those hormones and those endorphins in the mother. Those are the kinds of hormones that we want baby to be receiving. We encourage our mothers to participate in meditation type techniques through their pregnancy. Also to communicate with their babies, to talk to them out loud by using their voice, so that their babies are hearing and resonating with that sound. We also encourage fathers to do that same thing. It's actually quite innate, and it feels really unusual for most people when they attempt to do it, because you can't see that baby, but the baby's there, and so talking to them through this womb seems a little funny and a little odd. But there have been studies that have shown that as the baby will respond and release hormones to their mother's voice and to their father's voice, and they actually begin that process of recognizing that resonance and that frequency in utero.
I believe it 100%. So is the adjustment to a pregnant mother, is that safe?
Yes. Unequivocally, yes.
You took a deep breath.
To a pregnant mother is safe.
I tried to sort of surprise you, and I wanted to get a natural.
I was like, here we are.
I want a natural reaction from you, because I feel like that brings out good responses when I ask a tough question. But yeah, is it safe? I mean, that's what people are going to ask. Is it safe for the mom? Is it safe for a newborn kid? I kind of want to go that direction.
Yeah, it's 100%. It is safe. It's also effective, and it works. In fact, research has shown that women who have chiropractic treatment during their pregnancies have a 30% or more reduction in the length of their labor. What if I could tell you, I'm going to reduce your labor pain and time by 5%? Would you do it? What about 10%? 20? Okay, well, we have research that says 30 or more % reduction in your labor time. That's significant. Does it work? Yes. Is it proven? Yes. Is it scientific? Absolutely. And do you see the results? Yes. We see it every day.
You have a newborn baby. You want the best for them. It is terrifying when they get sick, especially before they can talk until they're older, right? I have a 5 and 6 year old, 6 and 7 now. Today's my son's birthday. How about that? Isn't that wild?
Max.
Watching them grow up is...
Happy birthday.
Happy birthday, Max. It's been a wild ride, and it's a blessing. But even when he gets sick, it just breaks your heart. Mm-hmm. But at least he can talk. So when they're so young, I mean, how do you keep them well? Is it safe to adjust them? I mean, let's just start there.
Yes. You want me to take a deep breath again? So the first thing is, absolutely, everyone, I would encourage you to find a chiropractic physician that you trust, that you have a good relationship with, someone that's certified and trained to work with infants. Of course, all chiropractic physicians can work with infants, but if they've had that additional training and shown that they have put a little more to it, right? It's going to be better, I think. And one of those is called the Webster technique. If they are familiar with, or if they have been certified Webster, that means that they've put more into their arsenal by the way of pediatrics and working with the pediatric population. So when do you get your child adjusted, their first adjustment? I tell my pregnant mothers to bring their children in, their infants, as soon as they feel ready. And we work with misshapen patients that have misshapen skulls, and we help to correct those. We do the cranio corrections, and some of them, I would say probably about 80% to 85%, we have had success. And there are some that, regardless of how much we work on them, that we have some correction that occurs, but their habits or the way they're sleeping or the way they're laying their head just keeps going back to the same molded situation, and we end up putting them in a helmet, or they need to wear a helmet. But for the majority of the patients that we do see that need that correction, they respond really well to it, and their cranial bones align and move and shift really well. We also will see patients, infants, really young, who have a difficult time nursing, and this is one of the ways that you can pick up on, might the infant need chiropractic care? One of the things that we're seeing a lot of is tongue tie. And some of them, I will say, I would argue, are not tongue tie. It's a malformation or a misalignment of the temporomandibular joint or the jaw. And so if you've got a retracted jaw, and you're trying to stick your tongue out to nurse, you're going to have a pretty hard time doing it. Well, a chiropractic physician can get in there and gently mobilize that joint and help to protract it slightly forward, and then the tongue will lift and come forward as well. And we've been able to help a lot of infants with that also, so their nursing improves. If you notice that a patient or an infant is not wanting to nurse on a certain side, so they'll nurse on one side, you try to nurse them on the other side, and they don't want to, or it looks like they're uncomfortable, or they're having difficulty turning their head, that's a condition that you really want to see a chiropractor for. You could even see a physical therapist for that, but that is torticollis. It's likely that infant, through the birth process, had a trauma that elicited a spasm in a deep neck muscle. And if you can get to a chiropractor, sooner the better, he will help or she will help to relieve that spasm. And then the infant will be able to turn its head, and the result will be nurse very well and without pain on both sides.
That's so fascinating. I didn't even realize there were things about the jaw or neck. I was thinking spine, like newborn infant, what's going on with the spine? And are you adjusting a spine? If so, what are you doing? Yeah,
so the way we adjust a newborn is really, I apply my 2 fingers under their back. So the infant will be laying face up, and I'll just apply those 2 fingers onto either side of the spine. And infants are so innate. Their movements, there's a lot of neurological function is still developing. And because of that, you see these certain movements and directions it's very neurological based. Because of that, they're so innate, I'll just push on each side and I'll test, and then sometimes you'll feel a resistance or a tension, which means, okay, there's probably some trauma that elicited a restriction in this part of the spine. And so I'll apply pressure to it, and then the infant will shift and move around a little bit, and then it will settle down. And then I'll move to the next segment, and I'll just apply a little pressure on the other side. If there's no tension, then I'll move to the next segment. And I just continue that way. We do the regular type of tests, like there's a test called Ortolani's and another one called Barlow's and Babinski's for neurological. We do a variety of different tests to make sure that the infants don't have some sort of other condition that might indicate a different type of care. But hip-related issues, we're checking for hips, we're looking for knee issues, ankle-related concerns. We'll evaluate the whole spine, and it's the skeletal system as well, not just the spine. So, like we said, the temporomandibular joint, the shoulders, the elbows, the wrists. We want to make sure that infant has a fully functioning musculoskeletal system that is not going to prevent them from properly developing and beginning the process once they need to get to crawling, and then also, rolling over and crawling and then even eventually walking. We want to support that whole process.
Pediatric care. I know that parents just want their little babies to be okay, and it's probably easier to trust a traditional medical setting because that is what people do. That is who a lot of insurances will take. It's just the society in which we live. You go to the doctor's office. the hospital with the pediatrician. That's what we did. You just want the best for your kid, and what do you say to parents out there who are looking for pediatric care and dentistry, and my kid is sick? I mean, do I go to natural medicine world? Do I stay in traditional world? Like, how do I navigate that and not lean into my feelings? Well, I think this is better than, the medical industrial complex. I mean, I'd struggle with this, right? Because I believe it for me, but then when my kid's life is on the line, I'm like, maybe I just take him to the pediatrician and give him antibiotics.
Yeah.
I don't want him to die, I know there was a lot I threw out at you there, but these are tough decisions for parents.
Absolutely. So I would say first, here we run an integrative medicine clinic, which means we do both Eastern, natural, and Western allopathic medicine. So I would say that I think that a lot of us put ourselves into a controversy that doesn't need to be there. And that controversy is trying to pit natural medicine versus Western medicine. That's odd. To me, I just say, does it work? Is it effective? And what is least problematic or least invasive to my child? That's it. I want to use the least invasive first. Well, if I have the choice between using a probiotic to help my child's gut or an antibiotic that will destroy all of the bacteria, right, and which we know will likely cause gut issues in the future, I would probably lend myself to using that minimally invasive procedure first. And so what's a less invasive process, or what is the less invasive treatment? And that's how I would go through it. That's what we do here. We like to take it in stages, saying, okay, let's go from the least invasive and the lowest intervention to the more significant intervention. But if we haven't tried the lower intervention, then why would we jump straight to this great big intervention that really has potential side effects and is harmful and potentially toxic? Like, all medication without reservation has toxic effects, all of it. So if we want to introduce a medication to our child, we should be asking ourselves first, not whether it's the right or the wrong thing, but first, are there any other options that are potentially less invasive and potentially less toxic that might also work?
Give me an example.
So an example, I want to help a child with an earache. We get a lot of ear aches. Okay, a lot of patients who come in. What are things that I can do for an earache? Well, there's some structural things that you can do. You have to understand the inner ear can build up with fluid, and it can have fluid build up in it. As fluid builds up in it, it causes pressure. That's where a lot of the pain comes from. When we look into the ear from the outside, we can see a little bulging or even redness in the ear, okay? So if we see this happen, what we need to do is, how can we structurally release that pressure? Well, the inner ear has a valve or a channel to drain into the back of the throat, okay? It's called the auditory tube. Some people have called it eustachian tube because in the past, apparently everybody that discovered anything wanted to name it after themselves or their children. So we try not to call it eustachian anymore. We just call it, because it's not Eustace's tube, it's our tube, but it's the auditory tube. That's the function of it. So
Eustace had an ego.
I know, right? So here, from the inner ear to the back of your throat, it drains. Your body's designed to do that structurally. So one thing that we'll do in the office is we'll do what I call an auditory tube sweep. And we'll go all the way to the back of the throat, the roof of the mouth, where that tube comes out, and we'll sweep across it to push, maybe if there's fluid that's gotten blocked or built up in there or stagnated, and we'll push that back and push it back and push it back, and then it comes and it starts draining out again.
So you're not telling somebody out there, this is not your medical advice, but this is something
This is what I do
as a professional
for patients.
Do this for patients, right?
Yeah.
Just be careful. We're not giving people, I don't know how this world works, but I don't want you to
absolutely. Thank you. And find a chiropractor or find a natural health physician that can do that for you, right? They can do an auditory tube sweep. That's a structural thing that you can do. So that would be less invasive to me than giving my child antibiotics. And why would I say that that would be less invasive? Because the moment I give my child antibiotics, then I have to try to reintroduce a whole host of other biotic cultures to try to rebalance his natural flora so that he can properly perform a whole host of functions throughout his whole body.
Because the antibiotic, kills everything, or?
Yeah, antibiotic is not super selective. And there are some more selective antibiotics, and certainly you could go for those as well. But more often than not, your antibiotics are just wiping everything out.
And do they rebuild?
Your body has a way of rebuilding. And this is interesting too, because in your gut, let's say, look at your GI, sometimes you'll have a condition that'll cause diarrhea, and you'll just empty everything out. And people have often said, oh, we don't want to really be emptying out the gut and the GI a lot, because then we won't have proper flora. We'll be decimating the flora that's in there. And you do want a proper balance of biotic cultures in the gut. Otherwise, we develop something we call a dysbiosis. It's a problematic biotic culture in the gut. But the thing that's really interesting is that you have this little kind of chewed up piece of bubble gum looking attachment to your intestines. Now, this is what we refer to as the appendix. Okay, we call it the appendix, and oftentimes people will have inflammation of their appendix. Well, the appendix, one of its roles is actually, probably its main and possibly only role, is to maintain a balance of your gut's flora. So that if you have some condition that empties you out completely, right, with diarrhea, and you have your gut flora is completely empty, then your appendix will start to contract and secrete some of the biotic culture so that it can properly regulate the gut flora. So that's a pretty cool feature of your body. And so what we want to do ultimately, though, is support the body in all of its functions. Going back to the ear, what else can you do for the ear? Well, some things that we've done that have helped the patients, and there's not a whole lot of research to back this practice, but there definitely is a lot of symptomatic improvement that patients have had with it, and that is ear candling. So using an ear candle, we've done that for patients as well. And if those of you that have never used that or are not familiar with that, that is it's essentially a wax tubing that you apply into the external portion of the ear, and then you burn it like a candle, and it draws some of the moisture up and out of the ear.
I've tried that before when I was incredibly sick, and I didn't notice a difference, but the more that I work with you, the more I realize it's not about the light switch going on or off. It's the progress can be kind of hard to measure in the moment, but you're orienting toward where you want to go, and the little steps of progress are so important. And it's I think everybody wants instant solutions. Yeah. And it's kind of reframing people's mindset around healing or life progress in that way. Right. And I think, and you know what I'm talking about, but I think I was wanting, this was a couple years ago, instant results. I think it was COVID or right before COVID, the worst flu I've ever had. And it evolved from throwing up and fever and chills and tired and coughing. And it was a nightmare. And then it ended with the worst ear infection I've ever had. The pressure was building up in my ears. I remember I was down on my knees and I grabbed a vacuum cleaner and I just screamed. Like, I ended up having my eardrums pop and bleed. Like, this is how bad everything was. So I tried the ear candle at some point. I mean, I was pretty bad. I was pretty rough. But anyway,
you were down the road quite a bit.
I was in tough shape. So I'm not hating on the ear candle, but I've tried it. It's interesting.
Yeah. Well, and doing that in combination with an auditory tube sweep, also doing some, also applying some essential oils topically to the external portion of the ear can be beneficial for patients, and also having your ear or your auricle adjusted. So there are bones. There's 3 bones in your inner ear: the incus, the stapes, and the malleus, and they can, especially in times of inflammation, get kind of adhered together. And this is how the percussion of the sound on your external auditory meatus. This is how this tympanic membrane will receive this just like that. It will receive the percussive wave. And then we have these bones in here, right? The bones will receive and transduce that signal from that tympanic membrane. And then that sends a signal down to these little hairs that allow us, the nerve fibers essentially, to interpret what we just heard. So it's a pretty sophisticated system. But if you have inflammation or swelling in there, you can actually get a little bit of adhesion between the two bones, and we can actually manipulate or adjust those and reduce the fluid and also improve the function and the movement in there of those bones.
I'm going to go off the subject a little bit, but inflammation. I mean, to what extent is inflammation just a huge issue in terms of health?
I think inflammation is our ultimate modern disease. If you look at any condition, you can probably wind it back to the root and the problem to some level being inflammation or inflammatory. I think we know that a lot of conditions are either an excess or a deficiency. So you either have a deficiency of a mineral, which we do see mineral deficiencies nowadays still too. Believe it or not, in the United States, we see a lot of mineral deficiencies. But we also see excess to a significant degree. We see so much excess of everything, even overeating, right? And overeating or eating too late at night and then going to bed too soon after eating. These things can all stir up inflammation. And one of the reasons it can stir that up, even just overeating, is because it is taking it to where typically the liver, a couple hours after you fall asleep, the liver kicks in and starts really doing a lot more of its job. The hepatocytes in the liver will look at the blood, essentially the blood product, and see if there's too much sugar or whatever else is in there. And if there's toxins which would lead to inflammation in the body and in the blood, it will pull those out and start storing them in fat or preparing them to be evacuated and eliminated from the body. So it can package it in bile and send it out to the gallbladder so that it's ready to go out and try to help break fats down, but be excreted by the stool. If we don't allow enough time between our final meal and the time we go to bed, we impede the progress of the liver to be able to properly perform its function.
So how long?
So I would say 2 hours to 3 hours. You want to make sure from the time you finish eating, you need to have no more food intake for 2 to 3 hours before you go to bed.
So should I stay up later to get those 2 or 3 hours?
No, because then it gets worse too, right? I mean, late hours, staying up late, it plays with your chronological clock and with your biorhythms, and then that causes an impact on your autonomic nervous system, and your autonomic nervous system really is that's what regulates your immune response, your autonomic nervous system. And if it becomes out of whack or unbalanced, then you'll start releasing inflammatory chemokines for whatever reason.
We're talking about inflammation, such a huge part of health, but let's get back to the ear, and maybe we've got another 15 minutes. One other very common ailment with kids and how you can address it through your way of healing.
Yeah, so asthma is something that a lot of kids deal with too. Rhinitis, upper respiratory stuff. But asthma, we treat a lot of asthma patients here. We help them resolve their asthma. And I actually have had several wrestlers who, one of them in particular, was on an inhaler, and he'd been on an inhaler. He was wrestling in high school and pretty competitive, top-level wrestler, and he was getting to where he was having a hard time even finishing a match just because he couldn't breathe. And he was having to use his inhaler, and this was even with frequent use of his inhaler. He still couldn't get through the match. So we started doing a variety of different things with him. We were working, first of all, to enable his whole lung to expand, or the entire rib cage, or the thoracic cage here, right? We want all of the lungs to be able to expand. Well, if I have restrictions in my ribs, if I'm not properly expanding or have proper mobility, or if my thoracic spine is not moving like it should, my lungs are not going to be able to completely fill themselves. Now, where else might this play a role nowadays for people? Long COVID. Long COVID patients will benefit significantly, especially as it pertains to the lung effects that they feel, by being adjusted, having their ribs adjusted and having their thoracic spine adjusted.
No kidding.
Absolutely.
Wow.
Absolutely.
What is going on? Okay, let's stick with asthma with kids, because I could ask you
I know
about
I jumped
long
over
COVID.
there.
Maybe we should do another podcast on long COVID.
Yes, and I just finished a formula that I wrote for long COVID too. Yeah. So it'll be a good one.
There's so much to talk about.
So asthma, this patient, we treated him using chiropractic manipulation for the thoracic spine and the ribs. I also, I've written a formula for lung capacity called BronchoHeal, and we put him on BronchoHeal. And then I utilized some acupuncture techniques to help calm that nervous system and try to reduce that autonomic nervous system response that will come and clamp down on those lungs, right? So within a matter of weeks, he was able to wrestle and get through a match without an inhaler. That's huge.
I love that you say within a matter of weeks, because everybody in this world wants it like their iPhone to turn on and give them instant results. They want it tomorrow.
Yeah.
And that's what I'm talking about. The progress that I've worked with you and just come to understand, it's yes, within weeks.
Yeah, within weeks.
Within weeks.
And then you get to keep that for a lot longer.
Yes, just a little bit of patience and commitment to the idea that it can be a nuanced. I mean, everyone wants one crack of the neck or one blessing on the head, and all of a sudden I can see again, and all these things. And I don't undermine the power of healing in whatever form it comes, but
and for the rest of their life, right?
Yes.
It's like, because they're never going to do anything for the rest of their life that might implicate them in another injury or infection.
Right.
I was like, come on. The reality is, do things that are going to set the stage for you. Do things that are going to set the foundation for you, to build you on a foundation, so when you do have an infection or you do have some injury, you're going to recover so much better, right? Or you're going to get through it so much easier. We know for a fact that if you're healthy and fit going into a surgery, like a hip surgery or a knee surgery, that you're going to recover. Your recovery is going to be so much faster and so much easier. That's a fact.
Yeah, and you talk about just how important metabolic health is, and we were talking about how, well, I'll go to the natural health food store and I'll buy a bunch of supplements and I don't feel any different. Mm-hmm. And you told me, please just take your metabolic health seriously. Everybody should. So even if I don't feel better the exact next day, and sometimes probiotics actually make me feel better right away. So I get it, but you're just setting that foundation for the next day and the next day. And anyway, so you said weeks with this kid. I sort of went off there, but it really helped him?
Oh, yeah. It made a big difference in his life. And I think he's wrestling actually in college now. So it was a success, right? It was great. And of course, not everybody turns out as dramatically as that. But all of my patients that we've worked with asthma-related issues, pediatric patients, they've all improved, all of them.
Is there one thing that you think over all of them has made the biggest difference?
I won't say that. I can't, because my whole approach has been multidiscipline and integrative. So I think that's probably not even maybe fair for me to say, because I usually look at patients from a multimodal approach. I'm not the kind of person that says this is a one-trick pony, or that this is the only answer, right? We all know that builder that the only tool he has is a hammer, so every problem he sees is actually a nail, right? So regardless of what it actually looks like or what it actually is, it gets fixed with a good pounding, Does that make sense?
Absolutely. And it sounds like a very convincing argument. I want to be told there's a one-size-fits-all solution. What's super disappointing is when it doesn't work. So my professional job is a auto detailing supply company. And we were on a podcast yesterday where we were talking to these guys who love our product line. Now, it has nothing to do with natural health. I mean, it couldn't be further from what we're talking about now. But what the guy was saying is when he got our products, it did what it was supposed to do. And it was so satisfying. Yes. And he loved it because it did what we said it was going to do. Mm-hmm. And one size fits all sounds awesome, but it's just not the way that health works, right?
Yeah, well, there is no one size fits all. It's called biological diversity. We're all biologically diverse. We all have genetic nuances and predispositions that set the stage for us potentially having interactions or reactions to certain things. So, yes, part of it's our genetics, part of it's our environment, and part of it is literally our outlook on life. It's the way we choose to interpret life as well. So all of those things play a role in the type of outcome or the type of result I get. And we have this thing in healthcare called placebo. And I've heard a lot of people refer to some of the work that I do as placebo a lot.
Really?
Yeah.
Chiropractic in general, or more kind of what you do?
Yeah, maybe more what I do, maybe, like some of the acupuncture or even some energy medicine and things like that. But what it really boils down to is that we're giving so much stake and so much credence to placebo. It's time for us, and I read an article on this actually recently, it's time for us to actually recognize that placebo is a big thing. It might be one of the biggest cure-alls that we have. And if we can get people to have faith in placebo, right? If we can get them to actually have faith in placebo, and then they can be healed as a result of placebo, then really, what are we doing?
Okay, I need to back up because it's a little confusing. Now, I believe that my mindset, what I believe to be true, it's a human connection where someone makes me feel validated, like I matter, like somebody fills up my soul based on an interaction, like that can change the course of my day. Mm-hmm. So I don't doubt that there's something way more than the numbers and the science.
Well, it initiates a release of hormones, endorphins, that, physiologically you're a different person. Your cells are responding differently. Physically, you changed. You're not even the same. You can't call yourself the same after those things occurred.
So tell me why placebo is so important. I mean, we've researched placebo versus non-placebo. Is there enough scientific data on placebos, or what are we learning about them? And can you reiterate that point again?
Yeah. So the whole point is this: that with the placebo, we've said a lot about placebo, and oftentimes people will point to, in research or researchers or doctors, they'll point to, oh, how did that happen? Oh, maybe placebo, right? And what are they saying? What they're giving credence to is something that they had nothing to do with, but that happened, but that the patient believed was going to happen, and it happened, right? So really what they're pointing to when a doctor says placebo, it seems like they're discounting it. But on the back end, if you really listen to what they're saying, even though they may not know that they're saying it, what they're saying is that there's something much higher than this medicine that's making you well. There's something much more to you that cures you, that causes an alignment of physiology, that causes a release of the proper hormones to help with mood regulation. There's something about you. There's something there that initiates this cascade of chemicals, of hormones, right? That and of neurotransmitters that is going to initiate the healing process. There's something there. If you study any of Bruce Lipton's, I don't know if you're familiar with Bruce Lipton, but it's like biology of belief type stuff. It's the fact that there is something above even our genetics. And I mentioned genetics earlier, and it's true. Our genetics can play a role in the way that we respond or react to a certain thing in life. But there's something even higher than genetics, above genetics, that can give cues to those genetics, whether they express or not. And what is that? And that is what those doctors are pointing to. They have no idea what it is. We don't even know how to study it exactly, right? Bruce Lipton is one person you can read about if you're into a lot of that, the energy work and how to create your day and your brain and how to change your life and your health energetically. Read a lot of Bruce Lipton's stuff. Look into it. It's fantastic. And he's probably taken that science farther than anybody that I know.
We just want our kids to be well. And it's really hard to know what to do when it feels like their symptoms are acute. There's a lot of podcasts left because I don't think we can do it all in one. But do you want to wrap up at all on something maybe we haven't touched on?
Fevers.
Let's talk about fevers.
Okay, fevers. 5 minutes, 4 minutes here. We'll talk about fevers. But fevers is a really interesting one because of what people define as a fever. A toddler running around the house, especially on a warm day, it's very common for that toddler, if you took his temperature, very likely could have 102. It could be up to 101, 102. No problem. No sweat. Nothing wrong with them at all. Most people would look at that and think he's got a fever. Okay. So when we're dealing with pediatric population, we've also got to recognize their fluctuations in temperature. My kid crawled into bed next to me last night, and my wife calls him the heater. He's like so hot. Like, oh, okay, I want to snuggle with you and help you feel comforted and loved and everything. But you're an oven, buddy, and there's obviously a significant temperature differentiation between he and his brother. Okay, so we're all biologically diverse. Well, this same child a number of weeks ago started developing a fever, and it's important when we talk about fevers that we start analyzing more of the patient than we do the number or the cutoff, the criteria. Where we get into trouble with fevers is when we start thinking that the policy of a specific number is the right indicator as to apply a specific treatment. Okay, so the question is, well, when do I apply a treatment like Tylenol? Well, recognize that Tylenol is one of the main things that causes liver toxicity. Right? Tylenol will cause harm to the liver. So in your mind as a parent, you should be saying, okay, I want to take care of my child, and I know I have Tylenol, and I'm not saying don't use it. I'm just saying you need to know what it's doing. Okay, make sure you know that you're ready and prepared, that this is potentially going to harm his liver before you start giving it to him. Okay, we have to do it like that. Then you have to also look at things. There was a study done on a number of different hospitals and the wards in the hospitals, and they took these children and they said, okay, these children developed fevers, and they watched them and they said, okay, some of these people, what we're going to do is we're going to allow them to just run their fevers and see how high they get. And we're going to record their disposition and how they behave and whether they're interacting well or not, and determine where their temperature is at each of those locations. Then the reason we want to do this is because we want to see throughout the hospitals if using a specific cutoff point, say like 103, if that's an appropriate way to start just medicating people with antipyretics or fever reducers. Well, what they found was they had one child that, say, had a temperature of 102.5 and was kind of lethargic and looked like, oh, I don't know if I really want to be involved. And then another child who was interacted and engaged and doing things, and he had a temperature of 104, right? And so you look at those two cases and you go, how is this the case? In a policy-driven environment, we would have medicated that individual, the 104, who was doing just great, way sooner. But he didn't show any sign physiologically that he needed it. Okay? Now, why is this important? It's important because also what they studied in this paper was the excretion of the stools and the feces in the pathogenic factors in their stools. So they found that the kids whose temperatures were allowed to go higher actually excreted more pathogenic bacteria and pathogenic factors in their stool than the kids who were medicated and whose temperatures were treated and prevented from going higher. So if we want to prevent chronicity of bacteria, of chronicity of dysbiosis, and chronicity of viral pathogens in our bodies, how do we do that? Well, we need to do that by watching the fever and letting it rise and allowing the child, as long as they're interacting and they're able to communicate and be quite lucid still, then use a variety of other techniques. One thing that you can do, and I did this with my son. My son's temperature on that night, it went up to 105.4. Okay? People freak out. But I'm watching him, evaluating him, I'm talking to him. And when it got up that high, yeah, did that make me nervous as a parent? Oh, absolutely.
So you're a human being.
Oh, man, I was thinking literally, wow, we're going to have to do something more severe, right? And I'm a bit of a purist in my work as well, even though I practice I have an integrative practice because I believe deep down that there's a place for both of them to work together harmoniously. But I'm also a purist in that I want this, and I believe that this approach can work even without the Western medication. It just doesn't sometimes, okay? But the reality is I saw it got up this high, and so what I did is I said, okay, I'm going to go get some cool cloth, and I'm going to wrap his feet and his legs in cool cloth.
You think about a cloth on a forehead, so okay, a towel?
Yeah.
Wet with cold water?
A wet, cool towel, wrap it on their legs. Why would I do this? And I'm going to tell you this, and it's super important. We don't wrap it on the head because if you wrap it on the head, your body is going to say, I need to warm that place up. Okay? So you have a temperature or a thermal regulator in the body. It is going to move heat from other places in the body to wherever it is cold. Okay? To try to keep the temperature neutral, keep it regulated in the body. So I wrapped his feet with the cool cloth, and then I checked literally in 2 minutes, and it was 102.5. Okay? Temperature dropped way down, and I kept those cool cloths on there, and then I just continued to monitor him again. He never spiked that high. He got up again to about 103.9, but he never got to 105 or that high again, which I was really happy about. But then the next day he woke up and it's fine, good to go.
How long did you leave it on there, and where did you put the towels again?
So I wrapped the towels cool. You want them cool. You don't have to have them soaked in ice cubes, but cold water, not lukewarm water and not hot water. It's got to be cool, cold water. And then you soak those towels, pull them out. You can strain them out a little bit so it's not dripping wet right in the bed. And then wrap them around the legs, so from the knees down to the feet. You don't need to go any higher than that on the leg. But wrap his legs, and that will pull, what that does is it will pull the temperature, the heat, from the upper portion of the body. The body will distribute it. So it takes that heat down to the legs, and it pulls it away from the brain. In this research paper that I reviewed, they surveyed pediatricians, and they surveyed mothers, parents, because they were trying to determine where this idea that they had to medicate a fever at a specific level came from, and what the fear was of letting a fever run high. And the reality is, in this study, in the research, they said, we went back and reviewed all of these papers and all of this research on fevers. And we never saw these cases that people are afraid about. They're talking about like brain injuries. He's like, we didn't see this. It didn't occur. Okay. And so we need to recognize, yes, is that a potential problem? Yes, absolutely. But that becomes a problem. You're going to see it start to become a problem if your child is not able to engage or interact. And you want to watch and see, okay, are they communicating with me? Are they making sense? Is it a very lucid conversation, or are they just out of it? And the moment you see them start to lose some of those connections, those connection points as far as being engaged in the conversation and what you're talking about, then that's when you can start using more significant things. But apart from that, you want to let the fever run high. I started off, I was going to tell you something. What was
I just want to know what else you can do for a fever.
Oh, okay. So wrap the legs. I also have a herbal formula. You can do an herbal formula, which is a fever clear formula, but it helps with just cooling the blood. Even making something like peppermint tea.
My kid's not going to drink peppermint
aloe
tea.
vera. Or you can put it in their sippy cup and go for it, man.
Okay.
Yeah, just tell them to drink it. It's important. They drink like Robitussin garbage alcohol stuff, right?
Could you put some honey in there maybe?
Yeah, you could put honey in it, yeah.
Natural, raw?
Organic, local.
Organic,
there you go. So, but yeah, think of the cooling herbs, aloe vera, your peppermint, things like that are going to be very beneficial. I know some parents find comfort using even just lavender and peppermint on the forehead when their child has a fever. I don't do that personally myself. I really watch my kids and allow their fevers to go up, and then I monitor them that way, and then I'll use the towels, and then I'll use my herbals. I've rarely used that for them.
Because parents don't have the herbals. They're not a doctor.
Yeah.
So I'm going to let it ride. Let's see the fever go up. It's 3 a.m. I'm terrified. I don't have a doctor to call. Like, what then?
I think those are the best solutions. Like, you have rags. Everybody has rags.
Yeah. So what if it gets higher and I start to freak out? What if you can't control my level of freak out? It's 3 a.m. I've done the towel method. I'm freaking out.
Then you'll probably need to go to the clinic, right? You'll need to go into the ER. I mean, if you can't, you need to sit back and go, okay, what's going on? First of all, to get a child up to 104, 105, people probably haven't really ever seen that.
Yeah, I've never seen it.
Yeah, okay. So I've seen it with my own child, and everybody's biologically diverse. What I'm telling you is, don't worry so much about the number, okay? Don't worry about the number. It's more important the symptoms. More important for you to know your child, interact with your child, engage with him, talk to him, just see if he's seeming like, if it's 3 a.m. and you wake your child up, he's going to be groggy anyway. So is it a typical groggy conversation, right? And you have ways of being able to determine that. If not, if you're panicked and you're thinking, hey, I've got to do something fast, then wake them up, get them out of the bed, and see if you can get them into a lukewarm bath. And I would say on the cold side.
How come?
Because what that will do is it will help the body to start releasing heat again, right? When they're wrapped up in their covers and the blankets and everything, they're generally hot anyway. So likely is, you got to look at it. Is the heat and the temperature and the fever, is that coming from, how much of that is actually coming from being wrapped up in the blankets? Like I said, my son, he's a heater as it is anyway. I take his temperature, at night when he's like cooking us all, and it's 102, 103 degrees, right? That's riding normal for him. So if you have a child who just happens to sleep hot or sweat a lot at night, it's very likely they just run high. And there's nothing wrong with that. And pediatricians and parents have really perpetuated this idea that we have to treat a fever at like 101 degrees. To me, I'm 101? if there's some symptomology with the patient that's suggesting I think that they need to be treated at that 101, then I'll treat them. But other than that, that doesn't even look like a fever to me.
If they want to know more, where can they go?
So if you want to know more, our website, you can go to communityhealthandwellness.com. You can see me on Instagram. It's, what is my Instagram? Dr. Ron Dummar?
We're also the Be Well Now podcast on Instagram.
But make sure you visit the Be Well Now podcast.
We're on YouTube. We're on Spotify. We're on Apple Podcasts. And we're on track. We're talking about stuff that matters. It's a place of passion. So if you dig what we're saying, if you made it this far, thank you so much. If you have questions, bewellnowpodcast@gmail.com.
Namaste.
Namaste.